The Noguchi Memorial Institute for Medical Research at the University of Ghana has ramped up its efforts to combat malaria, launching a series of public education campaigns for World Malaria Day 2026. Researchers took their message to the people of Accra, from schools to bustling streets, engaging students, market vendors, and commuters. They provided practical information on malaria prevention, testing, and environmental sanitation. This initiative aims to equip communities with essential knowledge to reduce malaria transmission and promote responsible health practices. Institute for Medical Research kicked off its World Malaria Day campaign in the classroom. Researchers visited St. Albans International School in Accra, where students participated in interactive sessions on malaria prevention, testing and treatment adherence. They learned that not every mosquito bite leads to malaria and not every fever is caused by the disease, emphasizing the importance of getting tested before taking medication. Students were also encouraged to adopt preventive measures like using insecticide-treated bed nets and minimizing exposure to mosquitoes to disrupt the transmission cycle. Associate Professor of Immunology, Professor Linda Eva Amwa, said educating children is crucial for malaria control because they readily absorb and share information within their families and communities.
You teach a child something and they go home and they are able to tell their parents and their friends what they've learned, and they also put it into practice. So today we didn't just come to give them theory, we actually came to teach them practical aspects of malaria prevention and also how to get tested for malaria and to read the test results themselves.
A research fellow and head of the Vector Research Group, Joelna Akoli, described malaria largely as an environmental challenge that can be controlled through simple but consistent actions. Beyond the classroom, the campaign extended to the streets. Health teams marched from the Noguchi premises through Okponglo to Bawaleshie, distributing educational materials and engaging traders, residents and commuters on malaria prevention. Doctoral fellow at the Institute, Mr. Festus Kojo Akwa, cautioned against self-medication, urging the public to seek testing at health facilities before taking any malaria treatment.
Should you get malaria, you should complete the full course of treatment. We've seen that for many people, when they get malaria and take the medication you are supposed to take the medication for 6 times, usually 2 times a day. For some people, once they take 4 or they take 3 and they realize that they are feeling better, they do not continue on the course. And that is not good because it's a source of resistant parasites, something we want to avoid.
A principal research assistant, Dorcas Jamabredu, also emphasized the need for communities to eliminate stagnant water and maintain clean environments to prevent mosquito breeding. According to the World Health Organization, there were an estimated 249 million malaria cases globally in 2022, with Africa accounting for about 95% of cases and 96% of deaths, underscoring the need for sustained action. The campaign forms part of activities marking World Malaria Day 2026 under the theme, Driven to End Malaria. Now we can, now we must. Researchers say bridging the gap between scientific research and community behavior remains critical in eliminating malaria.